Pancuronium. Pancuronium, a long-acting non-depolarizing muscle relaxant. Long-acting muscle relaxant. Lasts 60 to 120 minutes. Suitable for long surgeries. Blocks muscle signals, causing paralysis. Can cause blood pressure, rapid heart rate, and prolonged paralysis. Pancuronium provides extended muscle relaxation, but requires careful monitoring due to potential side effects. Introduction. 1. Pancuronium is a long-acting non-depolarizing neuromuscular blocker, NDNMB, of the aminosteroid class. 2. It produces skeletal muscle paralysis by competitively inhibiting acetylcholine at nicotinic receptors. 3. Known for its vagolytic properties, it can cause modest increases in heart rate and blood pressure, making it sometimes advantageous in patients where mild cardiovascular stimulation is beneficial. Definition. Pancuronium is a competitive nicotinic acetylcholine receptor antagonist at the neuromuscular junction, producing skeletal muscle relaxation without causing depolarization or fasciculations. Competitive antagonist. Blocks acetylcholine receptors at the neuromuscular junction. Produces skeletal muscle relaxation, by preventing acetylcholine from binding to receptors. No depolarization or fasciculations. Unlike succinylcholine, pancuronium doesn't cause initial muscle activation or twitching. History. 1. Developed in 1964 by Organon Laboratories as a modification of the steroid nucleus to reduce histamine release. 2. Introduced clinically in 1972. 3. Widely used in the 1970s–1990s before immediate-acting agents, vecuronium, rocuronium, became more common. Pancuronium classification. 1. Pharmacological class. Non-depolarizing neuromuscular blocker. Because it competitively blocks acetylcholine receptors at the neuromuscular junction, preventing muscle contraction. 2. Therapeutic class. Skeletal muscle relaxant, aminosteroid type. Because it's used to relax skeletal muscles during surgery or mechanical ventilation, and its chemical structure is an aminosteroid. This classification helps clinicians understand pancuronium's mechanism of action and its therapeutic applications. Chemical properties. 1. Chemical name. 2-beta, 3-alpha, 5-alpha, 16-beta, 17-beta, -17-acetoxy-3-hydroxy2, 16-bis, 1-piperidinium, androstan 4,1-dibromide. 2. Molecular formula. CH-bridge-NO. 3. Molecular weight. 732.7 grams per mole. 4. Structure. Bis-quaternary aminosteroid compound. 5. pKa. Approximately 8.6. Physical properties. 1. Appearance. White to off-white crystalline powder, as bromide salt. 2. Solubility. Freely soluble in water. 3. Formulation. Supplied as pancuronium bromide solution for IV injection. 4. Stability. Store at room temperature, protect from light. Mechanism of action. 1. Competitively binds to nicotinic acetylcholine receptors at the motor end plate, preventing acetylcholine from triggering depolarization and muscle contraction. 2. No depolarization, right pointing arrow, no fasciculations or potassium release. 3. Vagolytic effect by blocking cardiac muscarinic receptors, right pointing arrow, mild tachycardia and increased cardiac output. 4. Blockade reversible by acetylcholinesterase inhibitors, e.g., neostigmine. Pharmacokinetics. 1. Onset, 2 to 3 minutes, intubating dose. 2. Peak effect, 3 to 5 minutes. 3. Duration, 60 to 120 minutes, long-acting. 4. Distribution, VD approximately 0.2–0.3 L per kilogram. 5. Metabolism, minimal hepatic metabolism. 6. Elimination. Primarily renal 80%, some biliary excretion approximately 10 to 20%. 7. Half-life. Approximately 2 hours, prolonged in renal impairment. Pancuronium pharmacodynamics. 1. Sustained skeletal muscle paralysis. Blocks acetylcholine receptors at the neuromuscular junction, making it effective for long surgical procedures. 2. Increases heart rate and blood pressure. Vagolytic activity blocks parasympathetic stimulation, leading to increased sympathetic tone and slight increases in heart rate and blood pressure. 3. No histamine release. Doesn't trigger histamine release, reducing the risk of bronchospasm, hypotension, and allergic-like reactions, making it stable in patients prone to bronchospasm. These properties make pancuronium useful in specific clinical situations. Storage and disposal. 1. Store at 20 to 25 degrees Celsius, 68 to 77 degrees Fahrenheit, away from light. 2. Discard unused solution per hazardous drug disposal guidelines. Pancuronium interactions. 1. Potentiated by volatile anesthetics, aminoglycosides, magnesium, and lithium enhance pancuronium's effects, increasing muscle relaxation or paralysis duration. 2. Antagonized by cholinesterase inhibitors, e.g., neostigmine, reverse pancuronium's effects by increasing acetylcholine levels. 3. Additive effects with other NMDAs. Combining pancuronium with other neuromuscular blockers enhances muscle relaxation or paralysis. Understanding these interactions is crucial for safe and effective use of pancuronium. Clinical uses. 1. Facilitation of endotracheal intubation in elective cases. 2. Maintenance of skeletal muscle relaxation during prolonged surgeries. 3. Adjunct to mechanical ventilation in ICU, rare today. 4. In cardiac surgery when mild cardiovascular stimulation is desired. Pancuronium's specific properties make it suitable for these clinical applications. Pancuronium use in ICU. 1. Occasionally used for long-term paralysis in mechanically ventilated patients. Helps reduce patient ventilator desynchrony and facilitates ventilation. 2. Prolonged action can be problematic for frequent neurological assessments. Makes it challenging to evaluate patients' neurological status due to prolonged paralysis. 3. Accumulates in renal failure, not preferred in modern ICU practice. Pancuronium's elimination relies on renal excretion, and accumulation can lead to prolonged paralysis, making it difficult to manage patients with renal impairment. These factors have led to decreased use of pancuronium in modern ICU practice. Pancuronium use in anesthesia. 1. Suitable for long surgical cases when prolonged paralysis is required without repeated dosing. 2. May be chosen for cardiac surgery due to mild tachycardia and stable hemodynamics. 3. Not ideal for procedures due to long recovery time. Pancuronium's properties make it suitable for specific surgical cases, but its long duration of action limits its use in shorter procedures. Pancuronium use in emergencies. 1. Rarely used for emergency RSI due to slower onset and long duration. 2. More appropriate for maintenance after airway is secured. Pancuronium's pharmacokinetic profile makes it less ideal for emergency RSI but suitable for maintenance of paralysis after airway control is established. Administration and dosage. 1. Adults. 1. Intubation. 0.06–0.1 mg per kilogram IV, ed 95 equals 0.05 mg per kilogram. 2. Maintenance. 0.01 mg per kilogram IV bolus every 60 to 90 minute or infusion at 1 microgram per kilogram per minute. 2. Children. 1. Similar milligram per kilogram dosing. Neonates may have prolonged action. Pancuronium side effects. 1. Mild tachycardia. Due to vagolytic activity, pancuronium can cause a slight increase in heart rate. 2. Hypertension. Increased sympathetic tone can lead to elevated blood pressure. 3. Injection site discomfort. Patients may experience discomfort or pain at the injection site. These side effects are generally manageable, but clinicians should monitor patients closely. Pancuronium serious side effects. 1. Prolonged paralysis. Especially in patients with renal failure, pancuronium's elimination is impaired, leading to extended paralysis. 2. Anaphylaxis. Rare but potentially life-threatening hypersensitivity reaction. 3. Residual neuromuscular blockade. Postoperative weakness or paralysis can occur if pancuronium's effects are not fully reversed. 4. ICU-acquired weakness. Prolonged use of pancuronium in ICU settings can contribute to muscle weakness. These side effects highlight the need for careful patient selection, monitoring, and dosing. Pancuronium contraindications. 1. Hypersensitivity. Known allergy to pancuronium or other aminosteroid neuromuscular blockers. 2. Severe renal failure. Impaired elimination can lead to prolonged paralysis and increased risk of complications. 3. Rapid reversal not possible. Situations where rapid recovery from neuromuscular blockade is necessary, especially in non-ventilated patients, make pancuronium's long duration a contraindication. These contraindications emphasize the importance of careful patient selection and consideration of pancuronium's pharmacokinetic profile. Pancuronium precautions. 1. Dose adjustment. Reduce dose in elderly patients and those with renal impairment to avoid prolonged paralysis. 2. Neuromuscular monitoring. Continuous monitoring recommended to assess level of blockade and prevent overdose. 3. Prolonged ICU use. Avoid prolonged use in ICU unless absolutely necessary due to risk of ICU-acquired weakness and prolonged paralysis. These precautions help minimize risks and ensure safe use of pancuronium. Pancuronium advantages. 1. Long duration. Reduces need for repeat dosing, making it suitable for long surgical procedures. 2. Stable hemodynamics. Provides mild cardiovascular stimulation, supporting blood pressure and cardiac output. 3. No histamine release. Minimizes risk of bronchospasm, hypotension, and other allergic-like reactions. These advantages make pancuronium a valuable agent in specific clinical situations. Pancuronium disadvantages. 1. Prolonged recovery. Can lead to delayed extubation and increased ICU stay. 2. Accumulation in renal failure. Increases risk of prolonged paralysis and complications. 3. Slower onset. Compared to phenylcholine or high-dose rocuronium, pancuronium's onset is slower, making it less suitable for rapid sequence intubation. 4. Not reversible with Sagamodex. Unlike some other steroidal NMBAs, e.g., rocuronium, pancuronium's blockade cannot be rapidly reversed with Sagamodex, limiting management options. These disadvantages highlight the need for careful consideration when selecting pancuronium for clinical use. Pancuronium clinical considerations. 1. Best for long, stable surgeries with reliable postoperative ventilation. Suitable for long surgeries. Best used for prolonged procedures with stable patients and planned postoperative ventilation. 2. Avoid in patients needing rapid postoperative neurological assessment. Avoid in rapid assessment cases. Not ideal for patients requiring rapid postoperative neurological assessment due to prolonged paralysis. 3. Train of 4 monitoring essential to avoid overdosing. Train of 4 monitoring. Essential to assess neuromuscular blockade and prevent overdosing, ensuring safe use. These considerations help clinicians use pancuronium effectively and minimize risks. Comparing pancuronium with other neuromuscular blockers. Onset. Pancuronium, 2 to 3 minutes. Vecuronium, 2 to 3 minutes. Similar to pancuronium, rocuronium. Faster onset, 60-90 seconds. Succinylcholine. Fastest onset, 30 to 60 seconds. Duration. Pancuronium. Longest duration, 61-20 minutes. Vecuronium. Intermediate duration, 25 to 40 minutes. Rocuronium. Intermediate duration, 30 to 60 minutes. Succinylcholine. Shortest duration, 5 to 10 minutes. Elimination. Pancuronium. Primarily eliminated through the kidneys. Vecuronium. Primarily eliminated through the bile. Rocuronium. Eliminated through both bile and kidneys. Succinylcholine. Broken down by plasma cholinesterase enzymes. Histamine release. None of these agents cause significant histamine release. Cardiovascular effects. Pancuronium can cause mild tachycardia, increased heart rate. Vecuronium and rocuronium. Generally neutral effects on the cardiovascular system. Succinylcholine can have variable effects on the cardiovascular system. Each agent has its unique characteristics, and the choice of agent depends on the specific clinical situation and patient needs. Additional information. 1. Pancuronium's vagolytic effect can offset bradycardia from high opioid anesthesia in cardiac cases. 2. Reversal with acetylcholinesterase inhibitors, neostigmine, is standard if early recovery is required. 3. Its long duration has made it less popular in modern fast-track anesthesia. Current trends. 1. Largely replaced by intermediate-acting agents rocuronium, vecuronium in routine anesthesia. 2. Still occasionally used in cardiac surgery or long procedures with planned postoperative ventilation. 3. Rarely used in ICU due to risk of accumulation and prolonged weakness. Research. Research on pancuronium is focused on two key areas. 1. Studies examining its hemodynamic benefits in cardiac surgery versus newer agents. Hemodynamic benefits in cardiac surgery versus newer agents. Studies are comparing pancuronium's hemodynamic benefits in cardiac surgery to those of newer agents. Pancuronium's mild cardiovascular stimulation and stable hemodynamics make it a valuable option. However, newer agents like rocuronium have shown promise with faster onset and recovery profiles. Research aims to determine which agent provides the most benefits for cardiac surgery patients. 2. Investigations into optimal reversal timing in renal impairment. Investigations into optimal reversal timing in renal impairment. Research is investigating the optimal timing for reversing pancuronium-induced neuromuscular blockade in patients with renal impairment. Pancuronium's elimination is primarily renal, and impaired kidney function can lead to prolonged paralysis. Studies aim to determine the safest and most effective reversal strategies for these patients. Conclusion. 1. Pancuronium is a long-acting, stable non-depolarizing muscle relaxant with mild cardiovascular stimulation. 2. While largely replaced by shorter-acting drugs in modern anesthesia, it still has niche uses in prolonged surgeries and cardiac case. 3. Caution is required in renal impairment due to prolonged elimination. Pancuronium is the marathon runner of neuromuscular blockers, steady, long-lasting, and best reserved for when the race is meant to be slow. Cardiac anesthesia practice principle. Thank you for watching. If you liked this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.